Good morning, remote attendees. We are going to be starting the meeting shortly, probably within the next 5 minutes. Thank you.
Go ahead and call the meeting to order. Will the secretary please call the roll?
Director Harrington,
Present.
Director Lowry is absent. Director Robinson, Chair Ryder,
Ryder is here.
and for the record, Director Sorrell and Board Chair Garza are remotely attending,
Thank you.
and you do not have a quorum.
We do not have a quorum, and although we have board members that are participating remotely, we have to have an in-person quorum in order to allow them to participate remotely. So what we are going to be doing today is we're going to run through our agenda as it sits. We will just not be taking any votes, but we will be receiving all the reports we normally would receive, especially considering we do have directors participating remotely. Any votes that need to be had based on their timeliness will either go directly to the board or will be carried over to the next finance committee meeting in July. Stuff like this just happens sometimes because the committee size right now is a little bit smaller because we had a committee member who rolled off the board, and that position has not been filled yet, but we'll get there. So everything will almost be as normal. So I also appreciate everyone's patience. I had a speaking engagement earlier today, and I came to discover that there's some key bridges going across the south branch of the Chicago River that are out. So I parked on the west side of the river, took a scooter over to the Holiday Mart Plaza. I'm
crazy.
Yeah, and then I took a scooter back, and then I drove here. So, you know, the great thing about Chicago is Chicago is always a city on the make, and there's always, where there's a will, there's a way. All right. So we're going to first. Is there any public testimony?
We did not receive any registrations.
No public testimony. We're going to first. We are going to we're going to hold the finance committee meeting minutes until our next finance committee meeting in July. But for everyone's edification, they were already approved at the May board meeting, and we will review them more thoroughly next month. We're going to now go to items under the Chief Procurement Officer. You know what would be wild, Charles, is if I was doing this and we had 40 items, but we have 16, and most of them are fairly straightforward. So why don't you get us started?
Great, thank you. Good morning, Charles Jones, Chief Procurement Officer. Today we have before you 16 items. Of the 16, 11 required responsive letters from the Office of Contract Compliance. We have 7 back with 4 in process. So that.
So the first item is being presented by the Cook County Department of Public Health, and Dr. Joshi is remote. Do I have that right? Because I don't see Karen in here.
Yeah,
Marley.
yes.
Okay. All right.
I hope I'll do him justice. Good morning, everyone. I'm sorry, go ahead.
Oh, go ahead. Sorry.
Okay, no worries. So Marley Hendricks, Director of Public Health Administration, filling in for Kieran. So this first item before you is a contract to extend with no fiscal impact through 2026 in support of our lead remediation program.
Any questions on that item? We'll go to the next one.
Okay. Great. This next item, similar to the first, is also a request to extend with no fiscal impact in support of our lead remediation program for the end of fiscal 26.
Any questions on that item? If not, we'll go to request number 3.
Okay, great. Lastly, you have a request to extend and increase the contract for Bright Light Radiology. It's an imaging vendor in support of our breast and cervical program, not to exceed $49,582 through June of 27.
All right. Any questions on that last item? If
Thank
not, thank you, Marley. We're going to now go to request number 4, being presented by Dr. Daniel McCormick, our Executive Chief Clinical Officer.
Good morning. So I'm presenting today the contract in executed contract for a one-time capital purchase with Steris Corporation. Steris will be providing us equipment support for our robotics program and endoscopy program with the provision of a significant amount of equipment, inclusive of cleaners, anesthesia cabinet, respiratory rack, drying cabinets, endoscopic cleaners, further drying cabinets, all of which supports the robotic and endoscopic equipment. The total amount of that purchase for fiscal year 2026 is $547,355.02.
Thank you. Any questions for Dr. McCormick? Thank you, Dr. McCormick. We're now going to move on to request number 5, being presented by Dr. Lawrence Smith, our Chief Medical Officer, who is joining us remotely.
Yes, good morning, everyone. Can you hear me?
We can.
Alrighty, thank you. So I'm proposing or requesting approval for an amend and increase to the contract with University of Illinois Hospital and Health Systems. This is under our clinical service agreement to expand upon 2 service areas of obstetrics and gynecology, as well as hematology. The OB-GYN component constitutes $2.4 million. The hematology under our Department of Medicine constitutes the amount of $705,102. And this will include care under our family planning, maternal fetal medicine, UroGyn, as well as hematology services, including clinic coverage, inpatient, and call. So not to exceed the amount in total of $3,105,102 for the remainder of the contract period through September 30th, 2029.
All right. Any questions for Dr. Smith? I guess I just had a lost in space.
Yeah.
Thank you, Lauren. We're going to now go to request number 6, being presented by Ellie Bain, our Chief Legal Officer. You can stay there.
Okay. So this is a request for additional increase for a contract. Hall Render has been contracted as the external counsel for quite some time. We had a number of subpoenas arrive at the same time that required a significant amount of information gathering and redacting and all of that. We don't have that software, nor do we have the staffing to do that, so we needed to use outside counsel. As a result, it will exceed the amount of budgeted for this particular law firm, but the services have been rendered, so we do.
Any questions on this item? All right. Thank you, Ellie. We're going to now move to request number 7 and 8, being presented by Shannon Andrews, the Chief Equity and Inclusion Officer. Shannon, good morning.
I've got 2 items for you today. The first item is a request to execute a new contract with Superior Health Linens, doing business as a healthcare linen services group. This is a result of an RFP. This contract will be for 3 years, not to exceed $12 million. For services, they will be providing and furnishing laundry and linen management services for both Stroger and Provident Hospital, as well as our ACHN clinics. This contract includes 2 one-year renewal options. Next item, a request for a new contract with MedOne Capital Funding. This is from our GPO contracting resource. This vendor will provide rental and leasing services for the replacement and remediation of Care Fusion BD Alaris infusion, epidural, and patient control analgesia pumps in alignment with the FDA regulation requirements. This contract also has 2 one-year renewal options. It is for a 60-month period time frame, and it is not to exceed $6,732,660.
Any questions for Shannon? Thank you, Shannon. We're now going to go to request number 9 and 10, being presented by Scott Spencer, our interim chief finance officer.
Good morning. So the request number 9 is for Kaizen Health. This is a vendor that provides non-emergency medical transportation. Is an extended and increased contract for a fiscal impact not to exceed $2,500,000 with a revised contract period through June 30th of 2027. And the item number 10 would be for 3NetWise. And this is a software that allows us to manage referrals to CCH. It is also an extended and increased contract for a fiscal impact not to exceed $1,747,600 with a revised contract period through June 30th of 2027. Sorry, August 31st, 2027.
Any questions for Scott? Thank you, Scott. We're going to now go to request number 11, Human Resources, being presented by Wynn Buren, our Chief Human Resources Officer.
All right, good morning. This is a request for a 12-month extension of NAILR. NAILR distributes clinical job postings across healthcare career networks for hard-to-fill physician and APP roles. The original contract was for $165,000 over 3 years. With 2 prior increases, we're asking for an extend and increase by an additional $60,000.
Any questions for Wynn? Hearing none, thank you, Wynn. We're now going to go to request number 12 and 13, being presented by Adam Weber, Executive Director of Special Operations.
You looked up and thought you were seeing Andrea.
Well, I just wanted to make sure I had the right person there. I got notes.
All right. This first contract is an extension of an existing contract with Smith Group. No additional fiscal impact through March of 2027. Smith Group provides architectural engineering, construction administration services for our CIP projects at Provident Hospital. Currently working on a renovation of our pharmacy clean room and lobby and corridor upgrades at Provident Hospital. The second contract I have before you is a new contract with Spantech in the amount of $8,105,842.68. This contract will begin in August of 2026 and run through August of 2029. This was a result of an RFP. This vendor will provide management services of the health system's physical infrastructure and plant operation services across Stroger, Provident, and ACHN sites. They will continue to streamline operations, improve efficiency, reduce costs, and enhance our overall performance and sustainability.
Any questions for Adam?
Thank you.
Thank you, Adam. We're now going to go to request number 14 and 15, being presented by Donica Austin Cathy, Stroger Hospital Chief Hospital Executive.
Thank you and good morning. The first one is an execute contract with Cencora, formerly AmerisourceBergen, for prime pharmaceutical distribution services in the amount not to exceed $700 million. The contract period is 7/1/2026 through 6/30/2031. The vendor will provide pharmaceutical distribution services for all of Cook County Health. The vendor is one of 3 of the national pharmaceutical wholesalers that's been approved by the Health Systems GPO. We also performed an RFP as well as an RFQ between the 3 GPO vendors, and the contract period will have 2 one-year renewal options. Also to note, there is a $41.5 million in secure distribution value over 5 years. 29.9 of that is total pricing discounts, as well as 11.5 million in total rebates for starters.
Any questions for Donica? All right, thank you, Donica. Oh, we got one more, right?
Yeah.
Sorry.
And next, I have a request for expenditure approval. This is for with Priority Healthcare doing business as CuraScript Specialty Distribution. So a little bit of background. CuraScript has a business model that's based on an application and a line of credit process, which required extensive negotiation for the terms and conditions. We have worked collaboratively with CuraScript to finalize the contract terms, and we're currently in the final stages of obtaining signatures. But throughout the contract negotiation, CuraScript provided some medications for us for patient care, and as a result, we have accumulated outstanding invoices for products that have already been received and have been utilized in patient care. So approval of this expenditure would satisfy these outstanding payment obligations and continue to maintain our relationship with the vendor. We are finalizing a 3-year agreement with 2 one-year renewal options, which will establish a more formal process for purchasing framework and support timely processing and payment of future invoices going forward.
All right. Any questions on this item? Thank you, Donica. Thank you. Charles, you want to wrap this up? Or one more? Oh, yeah, that's right.
I'm here.
Dr. Lauren Smith coming back.
Yes, I'm back. This is a request for expenditure approval with Patterson Dental. Patterson Dental has been our contracted provider for dental supplies and equipment to support our clinical care. We had a contract that extended from November 2024 to February 2026. There was an RFP put out, and we have had a new contract that has been awarded with Patterson Dental. However, we had over expenditure, and so we are requesting the amount of $205,000 to cover past due invoices with Patterson Dental.
All right. Any questions for Lauren? Thank you, Lauren.
Thank you.
Charles.
That's it.
All right, that's it. As I said, these will be, this item is likely to be moved for direct introduction at the board meeting because of the timeliness of some of the items to make sure that they, that we keep them moving. So thank you, Charles. We do not have any emergency purchases being presented this month. We're going to move next to items under the Chief Financial Officer. So I think grant award related items are first.
All right, good morning again. So first item here is the receive and file report. There are 9 items on this list. We've got 1.6 in carryovers, 1.9 million of increases, and 1.3 million in renewals. All executive sponsored by Mark Spranka. Any questions on that?
No. Any questions? Right.
All right.
You ready?
I'm ready.
We can't take a motion on that, so we'll do that next month, for the receive and file, so get after it.
Okay.
Financial report.
Yep, here we go. All right, so, financials through April 30th, largely unchanged from where we've been. In March, we're 51 million unfavorable to budget. Healthcare services coming in with a $3.3 million net income. Health plan services with a 61.4 million net loss. Drivers remain what they have been over the past few months. Net patient service revenue unfavorable by about 1%, which we'll see on the next slide. And then we've got revenue from the health plan along with the medical claims expense more than budget due to the membership being almost 4% greater than budget. Next slide, so slide 3, we've got our combined income statements. So again, the net patient service revenue unfavorable by 1%. Capitation revenue favorable by 5.3%. So total revenues are favorable to budget, just under 3.6%. Operating expenses are unfavorable by 5.8%, driven by the medical claims expense, supplies, overtime, and salaries. One thing to note on the overtime would be that that variance has improved a bit from the last month. The changes being made within the operations are starting to flow through the financials, and hopefully we'll continue to see that as the year progresses. The combined net loss rather of 58 million that I mentioned, as you flip to slide 4, breaks down between the provider side on the left, which would be our hospitals and our outpatient clinics, and the health plan on the right. So at the bottom, you'll see the net income on the healthcare side of 3.3 million and the loss on the health plan of 61.3 million. Slide 5, just highlighting the favorable and unfavorable drivers. So in red, the net patient service revenue and the medical claims, and in green, the governmental support, capitation revenue, and the purchase service expense. So on slide 6, just a peek at the volumes here. So Stroger continuing to face some softness versus budget on the in terms of inpatient discharges, 5.5% unfavorable to budget. Surgeries, however, are the primary offset, being favorable at 4.4%. ACH volumes remaining stable and fairly strong year over year, both in specialty and primary care. And then at Provident, showing the ER visits short of budget, as well as the average daily census, despite or however also showing strength in surgeries, so favorable to budget by 12.9% and also better than prior year. So our operating trends on slide 7, just a couple things to highlight here. In the top left-hand corner, seeing we're now projecting, and we were last month as well, but projecting the admissions to decrease year over year, primary to declines in a few key areas, such as OB, pediatrics, nursery, and the surgical units. So the declines there are partially offset by growth in general medicine and oncology, but the increases there are currently not large enough to offset the declines in the other areas. The good news is on the outpatient side, we are expecting the clinic visits to be higher this year compared to last year. We've seen increases in a handful of our sites, on both the primary care and specialty care sides. Our payer mix on slide 8, just highlighting a couple things in the top right-hand corner, some minor changes. Medicaid coming in at 49%. So remaining largely unchanged. Revenue cycle KPIs on slide 9. We have our cash collections that rebounded slightly in the month of April. Our AR days, however, continue to not be where we hope they would be. However, we are in the midst of a thorough review of the rough cycle workflows, and so there will be lots of efforts there to figure out how we get those numbers back to where they need to be. On slide 10, our charitable and public program expenditures, projecting at this point $693 million, which is slightly less than we were projecting a month ago. The principal drivers remaining to be the charity care of $396 million and the other uncompensated care, which is in other words bad debt. Our savings initiatives slide on slide 11. On county care, the total savings has increased to $27.3 million, and the agency savings have increased to $17 million. And assuming we continue on our current run rate in terms of agency spend, we would then achieve that the $40 million of agency decrease that we budgeted. And then finally, we have the county care slide, which is the income statement showing the operating loss of $59 million. And again, the driver there is mostly the medical loss ratio that continues to be higher than budget. So with that, answer any questions that you might have.
Any questions for Scott? Thank you, Scott.
You're welcome.
We're now going to take our, everything's been an informational report today. But we're going to take a report from on our agency reduction plan. Scott, I think you're on this too.
It'll come up after.
Okay, all right. When I'm just going to let you run the show. You tell me who needs to talk.
Should I use my Boston accent on this?
Yeah, Boston, New Hampshire, whatever works. I got Dr.
I can
McCormick
text
up
him
there
and ask
too.
him to call in real quick. I think he's busy.
Eric's going to become my. Well, you know what? You're in contention to be my board meeting foil if you want.
Well, I am a Lions fan, so that could be it. There you go.
Oh, you poor guy. They've had one football player in the last 2 centuries.
I think you guys have the Madden cover going for you this year.
Yeah, we do.
Yeah. Oh, hope that works out for you.
We do. Yeah. Yeah.
All right. So let me undig myself from this hole now.
Listen. Hey, I love the Bears. We haven't had much going for us since January of 1986.
All right. Good afternoon.
Last year was good. 2007 was good too. They weren't good enough.
All right. Well, I feel your pain, and ours is probably going to continue, unfortunately. All right. So, good morning.
It's like the one thing we didn't need the Cubs to pass the torch on was the curse to the Bears.
So good morning. We're going to go over the agency usage report, and we'll go a little bit into our recruitment efforts for Guidehouse, the Guidehouse agency positions as well. So first thing, as you can see, since we started this process in September of 24, we've been able to cut our agency usage significantly. We have continued to go down in agency usage. We are currently at 689 agency employees in the organization, which represents about 8.9% of our staff. Next slide. This slide just kind of goes over where our highest agency usage is. We're aware that really our significant agency usage is in nursing, which we are working with NNOC right now on plans to continue to drop the agency usage there. The next group is health information coders and third-party billers, which is some of the conversations we'll have in the next couple of slides. So we do have a plan there, and we are working with AFSCME directly to work through our recruitment of these positions, and then the ability to then wean ourselves off of Guidehouse. RJ and Karen are going to walk over in the next slide what we are actually doing right now to help with the Guidehouse recruitment.
Good morning, RJ Dabney, Associate Chief Human Resource Officer. So yeah, this slide is highlighting our recruitment efforts specifically for the Guidehouse roles. So there are 3 roles tied to the Guidehouse recruitment. Third-party billers, HIM coders, those are the ones with the most significant volume, but also a pre-registration specialist. As Wynn mentioned, we've been partnering directly with AFSCME, really thinking through how we could accelerate hiring and increase the velocity of hiring for these roles. Some of the initiatives that we've partnered on are reducing some of the minimum qualifications, specifically for the third-party billers, to increase the applicant pool. Under Karen's leadership, we've had a lot of targeted recruitment sourcing efforts, as well as expanding our recruitment marketing and advertising, again, specifically for these roles. There was a countywide hiring event on the 27th of May, where we did include HIM coders. There we saw about 3 coders interviewed and offered 1 there. And then again, just increasing recruitment marketing overall. So you'll see certain job boards like LinkedIn that scrape all of our open roles, but we do boost specific key roles there. Indeed, ZipRecruiter, to name a few. And then Karen can speak on just some other initiatives we're doing to expand the candidate pool.
We can go ahead on the next slide. And good morning, everyone. Karen Hughes, Director of Talent Acquisition. No, it's on. Hello. Just have to speak a little louder. A little bit louder. How's that? Okay. All right. Is this better? Okay. Hi, everyone. Karen Hughes, Director of Talent Acquisition. So in terms of the continued recruitment work that we're doing to staff the Guidehouse position, some additional steps that we are taking is continuing to expand candidate outreach. So our team is working with marketing to enhance our visibility through targeted Google and LinkedIn campaigns. And we are going to be targeting areas outside of just Chicagoland. So hopefully that'll capture anyone who potentially is looking to, relocate. In terms of internal mobility enablement, we are working with AFSCME to create additional resources to better support internal candidates in navigating the application process, and also in staying informed about future opportunities. And then also we are working with the hiring leaders and labor teams to continue assessing the job requirements. So one of the learnings that we had from the countywide fair is that there's a couple of other course coder certifications that we have not included with our minimum qualifications. So we would like to propose that to the hiring leaders and AFSCME to see if we can expand and add those additional coder certifications so we can broaden the candidate talent pool. Those certifications are listed below, and then for a longer term opportunity, looking at some of the entry level certifications to create a pipeline for future openings.
Where are these 3 positions housed out of? Where do they office at? Is it in Matson?
Currently, yes, Matson, and I believe they are hybrid positions. So that's one of the challenges. But again, we continue to target anyone within a commutable distance and hopefully get some of those candidates.
Have we, and, you know, I don't know all the places, all the institutions that do the certifications, but I do know that you have some public community colleges and universities that sort of run that I-80 corridor, including Prairie State. I was just wondering how much are we focused on Prairie? Do they offer the certifications at community colleges?
So they do. So we are looking at different programs and colleges so that we can partner with them and also see if we can get all of our positions posted on there as well.
Yeah, and even though it's outside the great county of Cook, I would also look at Joliet Junior College, which I know has had both a lot of medical programming. It's actually where I think my mom got her initial nursing certificate from there. I got my associate's degree there too. Yeah, yeah. There's good resources, and so
I know, prior to Curtis's departure, we had a relationship with Malcolm X. I'm not sure if it's still there, but we had 8 rotating students there coming on site to work with our team. So that's great. I would, you know, between our great city colleges system, I would just, some of the, you know, the south suburbs also place it in need of people, you know, access to jobs. I think there's some great you know, Governor State University, you know, Chicago State's, you know, north of there, but still, you know, transit accessible, I think, to Matson. And this could be done later, but where is the Madison proper pronunciation? Look, yeah, it's actually people in the south suburbs screw it up all the time, but you're from there, you know that it is Madison. Where's the facility at?
I-57 and Route 30.
So it's right there at the interchange? Okay. So it's you know, Metro Electric to a Pace bus to get there probably, so. All right, sorry.
How long is the certification process to
I'm not
become
sure.
a
I would
certified
have to-
coder?
Yeah, I would have to look into that.
I've known people to do it. It's, you know, I think I don't know if it's a year or if I think it depends on how you're doing the coursework too.
Yeah, I think there's some other options we're looking at as well. We've met with Ask Me Twice and Ann. I know that we've got some work we're doing that she proposed. We just got the email today, so I think she's got some good ideas. And I know that RJ and Karen are working on that as well. I do have some thoughts on some additional recruitment strategies, but that would require us to partner with BHR and some other pieces too if we were to like really go after this, which we're doing.
Okay. I'm going to encourage everybody to get a little bit closer to the microphone and Sam's getting frustrated, I think, because no one's getting close. Well, maybe it's picking it up it's just hard to hear in the room.
It's also very hard to hear for the people who are remotely connected.
Well, he's listening on the headphones. I think he's got that covered. Yeah, I think it's in the room is the problem.
And just to highlight the progress I felt.
I don't see, RJ's doing a great job. RJ's like me.
Yeah, this isn't intentional. This is an accidental projection. But I didn't acknowledge the progress that we've already made in our recruitment efforts. So as of the report, we were up to 20 offers already accepted, but we already are up to 29 offers accepted in these roles. So progress is being made, but we're looking to accelerate that progress. Yeah,
I think the thing that sort of draws the eye is the third-party billing, because that's the one that we've only got a couple.
Yeah, and that was the one that we've done some work to reduce some of those minimum qualifications.
Yeah.
That will be an accelerated hiring process as well. So we should have some really good progress to report on the next meeting.
All right. Well, we're excited about that.
Awesome. Next slide, please. All right, and this is our report on locums. So over the last 4 months, we've seen a decline in locums across the agency, or across CCH. So we've gone from 43.72 to 39.78, so about a 9% decline. Any questions there?
Any questions on anything so far, including locum tenants?
The question that I would have is, how are we doing with the nurses? Because I know we had our pilots, and then they went offline after we discovered they were fantastic. And then I think they were supposed to come back online, but I don't think I've heard of them coming back.
We are online, so we have about 200, a little under 250 agency nurses right now. So it's at the lowest we've had it in probably several years. We went from, I want to say, a little over 500 or close to 500 about 2 years ago. So we've cut that number significantly. I know that in certain instances, they're part of the AHP process. We've had several job fairs to help us hire nurses. And one of the things we'll do to help us draw down on the nursing, we're being very intentional about demobilizing agency nurses as we bring new nurses in. So we think that that's going to make an effort in decreasing our agency reliance before the end of the year.
Right, I think you have the right mechanisms in place, but what I'm asking more about is we haven't necessarily seen the progress because it had to go through some type of bureaucracy, I think, before you could actually bring the program that had proven itself without a doubt.
Yeah, so I think what he's saying is that we're back online, so we're back to the point that you were looking for us to be at.
So that pilot was a few years ago. That was the nursing-specific accelerated hiring program. That has now been made permanent in the employment plan, and it's for all roles, not just nursing. So any role that has multiple vacancies is eligible for the accelerated hiring process. And I think year over year,
we're up 119. We're up 119 nurses compared to this time last year.
Okay.
From a hiring process standpoint, if that answers your question.
And the question I'm asking, and I thought you were doing a good job, but I just didn't know, so I had to ask the question. If we can continue to talk about that, because that's not a small moment on the balance sheet. So if we can keep that progress and keep our foot on the gas, so we can go ahead and remove that, because I think the program you have in place is fantastic. We just want to make sure that other priorities don't step in front of that, because that will never step off the balance sheet until we take it off.
Absolutely.
Well, yeah, so whether, I mean, maybe this is why you're in this role, Wynn, but the human resources officer, is the de facto chief morale officer, a lot of times along with the CEO, because, you know, I think one of the things that frustrates people is two things in nursing is over-reliance on agency staff, you know, people rotating in and out, not having regular, you know, sometimes people stay in a registry position or in an agency position for a while, he said, but a lot of times in nursing, it can be a rotation. But also like getting staffing up, right? Making sure that we always have adequate staffing, but we have more positions, and not just for turnover factors, that we want to have full, you know, to help improve our quality and our morale experience. So this is why this is important, and the progress is appreciated, and making sure that we're bringing people through, because it's better for the workers, it's better for the patients, it's better for the whole system, because that medical piece also drives system-wide morale, and you know.
And I want to give credit to RJ and Karen for the work they've done, right? The progress we're making from a recruitment standpoint is directly reflected from the work they've done, right? They've improved our processes. They've set very specific intentional targets for the recruiters to meet, and they've done a good job in following up on those. So the work they're doing is helping us tremendously.
Thank you.
All right. Okay. And that concludes our report.
All right, great.
All right.
Any other questions before we lose these guys? No. Well, there's if you don't know parliamentary procedure, and you're like, well, you guys don't have quorum, how are you going to adjourn the meeting? You don't need a motion to adjourn. The agenda is exhausted. We are adjourned.